So, welcome to the newborn unit. I'm Carol Bonareri, and I'm taking the charge of the maternity unit as well as the newborn unit. So, in this newborn unit, we usually have admissions from preterm babies who have been born from 24 weeks of life all the way to the 28th day of life. So, any critical unit that we have within that period is usually admitted in this unit. And we even have patients that are admitted here. Some are referred from the peripheral facilities that are around this area, and some are the units that complicate while within our facility. And I'm going to show you on the supplies that we usually use in the newborn unit. So this is the place where the supplies are kept. And here we have the medication that we need, and we have the daily use equipment and supplies that we usually use. And also in this unit, we have the emergency drugs, whereby they are placed in specific places whereby if you need an emergency drug and there's a case at hand that you are handling using the emergency drugs, you are able to access them and save the situation before you can always have additions from the main pharmacy. So we also have here we have supplies of the linen so that there is reduced infection from outside to the unit. And this is where the supplies for clothing and also the linen is kept. We also have drawers here where more supplies are kept. We have even the extra sheets that we need for the cardexing, for the continuation sheet that are kept here. When you're working in this unit, you are able to access those supplies. During an emergency, they are readily available. So in most cases, all the supplies that are needed in the newborn unit are stored in this cabinet. But there's always more supplies in the maternity unit. For example, there are supplies that are here have already been consumed, or there's another thing that is really needed in the patient care and it's not within the supplies that are available here. We can always source more supplies from the maternity unit that happens to have to act as the major store that supplies to this minor store. So what you can do when maybe you need a supply that is not available here, you can send someone if you're two in here, or you can use the intercom to make a call, and you can always ask for the supply to be gotten from the maternity unit, and you're able to have it and use it for care. And now, in this newborn unit, it's critical that in case of an escalation of a case, you are in a position to call for help. And now we have this place whereby we have an intercom where if you need to call for help, if you need to ask for a supply that you need as an urgent care, this is the place whereby you are supposed to use this intercom to make a call. This intercom is connected to the whole facility, so it can be you are making a call to the lab requiring some samples to be taken. You need more supplies that are mainly from the maternity unit, which is a core unit to this, and you need to call a clinician to come and do a review. This intercom is connected to the office. Any supply that you need, any help that you need, and it's always advisable that you have to have two people in the newborn unit, because it's not always the case that you have someone on the other side to answer the call. So if you need help and you have used the intercom, the other side of the call is not answered, then you can send one of you who, as you are working to, one can go to the respective area and call for the help that you need. If it is a supply, then that person can always get to that place and pick the supply so that it can help in that case of an emergency. I'm going to take you through what is expected of you as a student as you come to your placement in the newborn unit. So you need to ask a question when you feel you're not understanding something, or you don't know why something is done or how it is done the right way. So you take the initiative and ask as many questions as possible. We also have a set of standards that is expected of you as a student as you work or as you help in the newborn unit. First of all, food stuff is not allowed in the newborn unit. Idling is not allowed in the newborn unit. You cannot just come and maybe having a sleepy day, or you are working in the night shift and you come to sleep in the newborn unit. So there is no sleeping in the newborn unit. There is no food stuff in the newborn unit. And the newborn unit being a critical unit, you have to keep the hygiene standard with the highest requirement that is set. And that calls for you working in collaboration with the nurse that you are on duty with the others that are ahead of you and are more experienced. So that is why the initiative of always asking a question before you do something, if you're not confident about as small as it is, it's always for the utmost patient care to always ask before you do. When you're not sure of something, you always ask. When you see something and it's the first time you are seeing it, always inquire, know more about it, so that as you participate in the care, you understand what you are dealing with. It is good that you know your patients. Well, the reason as to why it is important to know your patient, you are able to know what care you are giving. And by knowing your patient, I mean having a detailed history of the case at hand. You will not be handling all the patients, but that specific that you have been allocated for that day, it is your initiative to go deep, understand the condition that they have come with, the management that they are under, and in case of escalation, how it happens. And that scaling down helps you as a student to understand a case at a time, and also comprehend its management, so that in the subsequent areas where you have an encounter of that, you are able to build more expertise and more experience on it, and at the end of the day, you are able to offer the best patient care. As part of the standard care and part of the set rules that are set within the newborn unit, you expected that you should always be 2 students in the newborn unit. At no point is the newborn unit supposed to be unattended. So always be 2 students in the newborn unit. And at no point should you leave the newborn unit unattended. If one of you needs to maybe go and attend to some emergency, then another one has to remain behind to oversee the patients that are within the unit. In the newborn unit, it happens that the primary caregiver always happens to be the mother of the baby. And it is advisable and it's very critical that in whatever that you're doing, as you are handling the patient, always involve the primary caregiver in your care. In the case whereby a situation escalates and you see a change in any patient that you're handling, always call the nurse that you are with in the unit, so that you are able to inform them whether it is to a lower side, whether it is to a higher side. Always contact, always call for help, and inform the nurse that you're with of any change in the status of the patient that you are dealing with, so that appropriate escalation of care is able to be done.